Hola y muy buenos días a todos. Gracias por conectarse a esta sesión informativa de la OPS sobre la pandemia por COVID-19 en la región de las Américas.
Hello, everyone. Welcome to this press briefing. This is Sebastián Olien from the Communications Department at PAHO. And as usual, this session will be between 45 minutes to an hour, and we will be taking questions from you up to that point. For agenda matters, this press conference has been moved to Wednesdays starting this week. We have already received questions via email, and you will also be able to ask your questions via chat by clicking on the Q&A button. We will also be taking your questions live, but we like to kindly ask you to write the questions on the Q&A chat so that we can coordinate the questions. Please remember to include your name and media outlet when you send your questions. I would like to also remind you that we have simultaneous interpretation into both English and Spanish, and you can choose the language by clicking on the interpretation button. Today, PAHO Director, Dr. Carissa Etienne, will give you an update on the epidemiological situation for COVID-19 in the region and also the way in which the pandemic is affecting our healthcare workers. Today, Dr. Etienne is joined by Dr. Ciro Ugarte, Director of Health Emergencies Department at PAHO, and Dr. Marcos Espinal, Director of the Department of Communicable Diseases. And without further ado, I would now like to give the floor to Dr. Etienne for her opening remarks. Dr. Etienne, go ahead.
Thank you for joining today's press briefing. As of this week, the Americas have recorded almost 13.5 million COVID-19 cases and over some 469,000 deaths. After months of unrelenting spread, cases are stabilizing in the United States of America and Brazil. However, these two countries continue to report the most new COVID-19 cases globally, a clear sign that transmission is still active. Along most of the Caribbean, however, we're continuing to see a surge of the virus. In fact, nearly half of COVID-19 cases in the Bahamas have been reported in the last 2 weeks. As we look south, with the exception of Nicaragua and Costa Rica, which just reported its highest daily case count, most countries in Central America have seen COVID-19 cases drop over the last week. We're also seeing these downward shifts in South America, where Chile and Uruguay have managed to flatten their curves thanks to effective infection control and response tactics. Despite these hopeful trends, the human cost of this pandemic remains unacceptably high, with almost 4,000 deaths a day in our region. The scale of this pandemic is unprecedented, and no other group has felt this more acutely than the very men and women who make up our health workforce. Our health workers are our heroes. They are working longer hours than ever before, under more stressful conditions than any of us could imagine, often making extraordinary personal sacrifices as they risk their own safety to help patients in need. While our health workers, nurses, doctors, and other professionals are just a tiny fraction of our population, they are especially vulnerable to COVID-19. Our data shows that nearly 570,000 health workers across our region have fallen ill, and more than 2,500 have succumbed to the virus. Based on this data, to date, we have the highest number of healthcare workers infected in the world. In Canada, health workers represent more than a quarter of all reported COVID-19 cases, while in the US and Mexico, which have some of the highest case counts in the world, health workers represent 1 in every 7th case. In fact, the US and Mexico account for nearly 85% of all COVID deaths among healthcare workers in our region. Women who are the majority of our health workforce, have been disproportionately affected. Nearly 3/4 of health workers diagnosed in our region with COVID-19 are women. These numbers are alarming, and they beg the question, why are so many health workers becoming infected? When we look across our region, we see a few patterns that can help us answer this question. As countries scrambled to respond to the virus, many health workers were redirected to the outbreak response without sufficient training to protect themselves as they were treating COVID-19 patients. And with a surge in staff and patients, hospitals became overcrowded, and many were too slow to implement triaging protocols. This meant that COVID-19 patients were exposed to others who may have been seeking care for different conditions. And soon everyone carried a risk of infection, leaving health workers more vulnerable. And indeed, preliminary data from Chile shows that nearly 70% of health workers were worried about contracting COVID-19. This was especially problematic early on when personal protective equipment was running low and health workers were forced to reuse masks and gowns, seek alternatives, or forgo protection altogether to care for those in need. Tellingly, a survey of health workers in Mexico showed that nearly half were not provided PPE at work. Beyond the risk of infection, after months of operating under enormous pressure, our health workers are acutely aware of the mental and psychological impacts of this virus. A survey of health professionals in Paraguay found that more than 40% were feeling anxious, a third are experiencing depression, and more than a quarter are suffering from insomnia as a result of COVID-19. And this stress, which affects their work and relationships, is worsened by stigma and discrimination. There are documented cases of health workers feeling isolated as friends or even family avoid them for fear of getting sick. Others are being ostracized and being denied access to restaurants or public transportation, while a few have reported being evicted from their homes due to the jobs. Shockingly, dozens of health workers have been assaulted over the last few months as a result of the public's misplaced fear, misinformation, or frustration from this pandemic. For all of this, when we have an effective vaccine, health workers must be at the front of the line, together with those most at risk of severe COVID-19, to receive the vaccine. Indeed, many health workers across our region are already volunteering for vaccine clinical trials, for which we once again thank them. So that's why today I ask countries to take the necessary steps to give our healthcare workers the protection and peace of mind that they deserve now and in the future. To meet immediate needs, countries must ensure that health workers can do their job safely. This will require maintaining sufficient supplies of PPEs and ensuring that everyone is effectively trained in infection control to avoid risking their own health. PAHO has been supporting countries in building safer environments for patients and health workers alike, including by building designated triage and case management zones. And we have also donated over 31 million masks and more than 1.4 million gloves and gowns to protect our frontline response. Health workers should be working regular shifts, not overtime long hours, since we know that the risk of infection increases the longer we work. This will in turn reduce burnout and stress. In the event that health workers get sick, including those who may not be caring for patients directly, like our janitorial and cafeteria staff and hospital administrators. They should have the resources, the help, and the compensation that they deserve. Over the coming months, countries must also boost their healthcare capacity. We must enhance occupational health programs to ensure safe working conditions and fair pay for health workers. These programs help ensure the necessary protection and services for their physical and mental health needs. This is particularly important for women, who comprise the majority of our health workforce, who must be supported to fully participate and lead the response to the pandemic. Clinics and hospitals must also redistribute work so they can cater to COVID-19 patients while maintaining other essential health services. Critical to this will be leveraging health teams at the first level of care, including community health workers, and the use of telemedicine and other virtual technologies to minimize hospital traffic. PAHO has been providing guidance to countries on this, helping them improve systems and helping them train their workforce. Finally, countries must ensure that we're better prepared when the next health emergency strikes. This starts by expanding our health workforce. Across Latin America and the Caribbean, there are just 20 physicians per 10,000 people, much lower than the WHO's recommended 30 per 10,000. So countries must hire more doctors as well as nurses, midwives, and first responders. We need to provide essential services for this pandemic and beyond. When countries expand their health workforce, it doesn't just improve health outcomes, it drives economic growth. So this is both a necessary and a smart investment. This virus will remain with us for years to come, as I've said before. So it's critical that we provide health workers the support and resources that they need to heal the sick and see us through this pandemic. Our very ability to respond to the pandemic depends on it. So as I close, a big thank you to all health workers across the Americas and throughout the world. Over.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. We will now begin with the questions that we have received via email, and then we're going to move on to the questions that we will receive on the chat. You know that you can ask questions by clicking on the Q&A button, and please begin by identifying yourself by name and media outlet. The first question is from Gideon Long from Financial Times, and it says, does PAHO have a registry of how many healthcare workers have contracted COVID-19 and or died as a result of COVID-19 in the countries of the Americas? And if not, are there any international organizations that are monitoring these figures, Dr. Etienne?
Thank you for the important follow-up question. Let me assure you that PAHO is continuously monitoring the pandemic response within our region, including the collection of data about our health workers. Health workers are becoming infected with COVID-19 at an alarming rate. Globally, they represent about 10% of all COVID-19 cases. On Monday, we launched an Epi alert that tracked health worker infections from 19 of the countries in our region. As I've just mentioned in my remarks, this data shows that almost 570,000 health workers have been infected with COVID-19 in the region of the Americas. And the majority of cases are among young people between 30 and 49 years of age. And while the situation varies from country to country, within our hardest hit nations, health workers are particularly at risk. In the United States, more than 140,000 health workers have become sick with COVID-19, and 660 of them have died as a result of caring for others who are sick. In Brazil, almost 270,000 have tested positive for COVID-19, and more than a third of these cases have been among nursing technicians and assistants who are in close contact with patients. In Mexico, nearly 100,000 health workers have fallen sick, most of them also women and many of them nurses. Throughout this pandemic, we have been asking a lot of our healthcare workers, and we continue to count on them in every clinic and in every hospital. So in light of this, PAHO is urging countries to strengthen health services capacity by equipping health workers with the appropriate resources and the training that they need to do their jobs safely and effectively.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. And then the next questions are vaccine related. One of them is from Royce Caution Jones from A Witness News Bahamas, and it says it asks whether PAHO provide an update on progress on a vaccine for COVID-19. He says that so far only one has been approved. And then Juan Manuel Nueves, correspondent in Argentina from the Censura Agency, asks, it says, China has begun cooperation in clinical trials for different vaccines against COVID-19 with several countries in the world in our region. Argentina, Brazil, and Peru. So how does this cooperation contribute to the international public safety, or public health rather? Dr. Espinal, go ahead. Thank you very much for this question. These are two very important questions. And in terms of the efforts that are being made for vaccines that are in the clinical trial stage and the cooperation between Argentina, Brazil, Peru, Mexico, and potential vaccine manufacturers such as those in China and other countries that are being tested, such as the one in the UK, PAHO welcomes this leadership from our member states and our countries in the region. It's important to clarify that PAHO has long fostered South-South cooperation, North-South cooperation, and triangular cooperation. So everything that is in the interest of finding a solution for this pandemic is welcome with open arms, and it shows leadership in our countries. Let me also clarify that countries such as Brazil have a long history of manufacturing vaccines. And it's important to bear in mind that when the vaccine or vaccines become available, we will have to engage in technology transfer for many of the countries that do have manufacturing capabilities, because a single country will not be able to manufacture all the vaccines needed for the almost 8 billion people we have in the world. So we also welcome the possibility for Argentina, Brazil, and others to manufacture these vaccines for the region. So, like I said, we welcome that. The vaccine is a public good, and our region is showing nothing but leadership and the fact that they care about their people. And that's why they are making this significant contribution to the global public health. Now, in terms of the Bahamas, let me clarify that there are no approved vaccines so far. The Russian vaccine is in the research phase, but it has not yet approved to be used through COVAX or any other facility approved by international organizations. There are about 30 or so vaccines that are in the advanced clinical trial stages, phase 1, phase 2, or phase 3, which are phases where the vaccine is given and also a known placebo that has no effect whatsoever, to monitor and over time see who develops antibodies and who don't, and the level of protection or efficiency that a vaccine has. But so far, we are yet to find one vaccine that can be used. As soon as it becomes available, PAHO will immediately engage in facilitating the distribution of such vaccine to our member states. Thank you. Thank you, doctor. The next question is from Carmen Pan from Politico, and it says,
PAHO region doing in terms of supplies of medicine, such as intensive care unit drugs and other needed to take care of people with COVID-19? And also, do countries in the region have access to remdesivir and dexamethasone? Doctor Ugarte podría tomar esta pregunta.
Dr. Ugarte, could you answer this question, please? Doctor, could you unmute your microphone? Yes.
First, in relation with the situation of the PAHO countries in the Americas, most of the countries are in a fairly stable situation in terms of supplies and equipment, etc. But we've seen, in some cases, limited access, especially in countries with a high number of cases in a short period of time. In that regards, some countries have limited access, for example, for ICU supplies, medicines, ICU beds, and PAHO has been helping some of those countries with limited amounts of those equipments and supplies that have been distributed according to the availability and the need. And regarding the access to remdesivir, it is limited in the region. It is actually very limited. So in that regards, we have shown that that dexamethasone and other corticosteroids that have proved that are effective are in good supply in the country. So a new study, probably you've seen, that has been published today, reaffirms that initial findings of the benefit of corticosteroids and those supplies. But I would like to highlight that with a vast amount of existing and emerging evidence, PAHO has been reviewing all those evidence and helping the authorities in the countries in deciding how to manage COVID cases. Particularly, PAHO released an update of the ongoing living update of potential COVID-19 therapeutics, particularly for persons with severe disease. And the summary has been released, a few days ago. Also, we would like to highlight that PAHO has been helping the countries through different purchasing procedures, through the existing revolving fund for medicines and essential supplies and equipment, but also through other mechanisms at the global level. So the countries have access in terms of purchasing mechanism at a fair price and a quality, with the quality that is needed, and so on. So, and also we've been supporting the countries in webinars on case treatment for mild diseases, for children, for elderly, and also for severe cases. And with hundreds of countries or healthcare workers from the countries that participated in those webinars and continue to participate, this is a crucial issue, particularly in ICU services. Thank you.
Gracias, doctor. La siguiente pregunta.
Thank you, Dr. Ugarte. The next question is from Kian Kwan from NPR, and it says,
joining the COVAX facility, the WHO's global vaccine initiative will require countries around the world to cooperate and pull to be effective. What's the impact of the US not participating? Can the initiative be successful without buy-in from the US? And he also says, and China, Russia, I believe. Dr. Espinal?
Thank you very much for that important question. The COVAX facility is an unprecedented initiative that aims to globally help all countries. Today, more than 170 countries has agreed to participate in the COVAX facility. Yesterday also, there was an announcement of European countries of donations to the COVAX facility. So it is a major unprecedented initiative trying to bring to the people a global public good, which is a vaccine. Now, the US has been a generous donor throughout for decades in many different initiatives, and the international community is grateful to the US for donating to help countries in need. So, of course, any initiative that has situation where funding is needed will have major impact if a donor is not present. So while every country make their own decisions, is sovereign and make their best decisions, we encourage the US to reconsider and participate in the COVAX, because it's a global public good that will bring vaccines to the people in need in many countries, not only in this region, but also in Africa, Asia. It is no doubt a major initiative that will bring a vaccine in the future to our people. Thank you.
Gracias, doctor.
Thank you, Dr. Espinal. The next question comes from Juan Pablo de Marco from El Observador newspaper in Uruguay. And it says, when the vaccine arrives, will governments have to continue with their lockdown measures? Is it expectable to see outbreaks regardless of whether or not the vaccine exists? Dr. Etienne?
Without doubt, we are facing a unique challenge with a new virus for which we do not yet have a vaccine. Experts around the world are working faster than ever before to ensure that we have a safe, effective vaccine as soon as possible. So thanks to their efforts, we are hopeful that we will be able to reduce what's often a very long process of years of research, development, and regulatory approval, that can be done within a 2-year or less than 2-year time frame. And indeed, many vaccines are now in phase 3 clinical trials. And so we are hopeful that at least one or more of these will be effective in providing lasting protection against COVID-19 with few or no side effects. But it is too soon to tell. And so we wait and we hope. And even when we have the vaccine, we will not be able to go back to normal, at least not immediately, since vaccinating an entire population may take some time. Until we are all protected, a vaccine will be considered as part of our comprehensive package of measures against this virus. So for some time, countries will have to continue to test, to isolate and treat patients, to trace their contacts, and to institute containment measures from time to time, and to avoid a resurgence. So also, there is a responsibility for us as individuals, and that will mean keeping our physical distance, wearing a mask, washing hands regularly, and coughing safely away from others. Of course, we are tired, and we are counting on getting a vaccine as soon as possible so we can go back to our normal life. But we need to continue to be patient, and we need to continue to follow many of the public health measures that have been spoken about so often before. It is a total package. Thank you very much.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. And now I would like to give the floor to Jacinta Molina from CNN. So, Jacinta, if you can hear us, you have the floor. Thank you very much. I would like to ask about the situation that we're going to see in Chile on October 25th. We're going to have a constitutional referendum, and in this country, elections can only take place on site. So, government said that people that have tested positive for COVID-19 will not be able to vote because the government does not have enough time to come up with an alternative voting system, be it mail-in or any other electronic way. So in that sense, what is PAHO's recommendation in these cases, not only because of the upcoming elections that we will have in Chile, but also in other countries in the region? Should we deny the right to vote to patients that are COVID positive, or should governments work to develop short-term alternatives in order to ensure that right and also protect the rest of the population? Thank you.
Thank you very much, Jacinta. Dr. Ugarte, could you please answer the question? Yes, with pleasure. PAHO has been working for several months now with OAS and directly with some countries such as Bolivia and Chile, the Dominican Republic, among others, in connection with the difficult decision to be made by the countries regarding two rights, the right to health and life and the right to vote. If we could have remote voting for example, cases in lockdown or quarantine cases, that would be the best option. We need to give priority to the right of the rest of the population not to acquire the disease and to undertake extreme measures, and also in case of voting on site, the use of surgical masks, social distancing, and also hand hygiene stations, as well as other measures to control infections are necessary to be implemented, and they have been implemented already. It is also necessary to be cautious when, for example, a pen needs to be used, when fingerprints need to be taken, and also exposure in public. That's the reason why hand hygiene is very important. So in this sense, the authorities need to verify as much as possible so that individuals do have the right to vote under health conditions, not only for those individuals, but also for families, the communities, and the country. Thank you. Thank you, doctor. And now we also have a live question by Gisela Salomon from AP. Gisela, can you hear us? You have the floor.
Sí, buenos días.
Good morning.
Quería volver al
I would like
comienzo
to go back
de la conferencia cuando la
to
doctora
the
Etienne
beginning of
dijo
the
de que
press
estaban
briefing
bajando
when
las
Dr.
cifras en
Etienne
algunos de los
said that there
países.
has been a drop in the
Esta
number of
región ha sido el
cases in some
epicentro de la
countries.
pandemia durante
This
meses.
region has
Hay
been the
algunos países
epicenter of the
que, como bien
pandemic for
dijeron,
months.
están
Some
mostrando
countries
signos
are
positivos.
also showing some
¿Avisaron
positive
ustedes
signs.
algún cambio con
Do
la
you
llegada de la
see
primavera
any
y el verano a
change
los países del
now
sur?
with the
¿Y
beginning of
creen que el
spring and
invierno, por
summer in
ejemplo,
the
en los
southern
países del norte
countries? And do you
podría
think that winter in
significar
the
un retroceso y
countries
agravar
of
la
the north
situación
could
nuevamente?
also indicate
Esa pregunta por un lado, y
a relapse
segunda,
or
relacionada
a
también
worsening of the situation? That is
con
the first
Brasil.
question. And the second question
El
has to do
Imperial College de
with the
Londres
vaccine. Imperial College
ha
of
dicho
London
que los porcentajes han
has said
caído a su
that the
nivel más bajo desde
percentages
abril.
have dropped
¿Son
to the
optimistas
lowest
ustedes de
numbers
que
as of April? Are you optimistic in the
esta
sense
tendencia
that this
continúe
trend
o
would
creen que es
continue,
algo
or do you
transitorio?
believe that this is just something temporary? Thank you, Gisela. Dr. Espinal, would you please answer these questions? Yes, with pleasure. Thank you very much, Gisela, for such important questions. We have not had a full calendar year with COVID, so it is difficult to forecast what will happen with the changes in season. We cannot ignore that there could be another peak in winter in the northern hemisphere countries and countries that have already had the first wave. But the southern countries should not dismiss this. We have also seen countries such as the Dominican Republic in Central America that in summer also reported a very high number of cases. We need to wait and see what happens and continue, as our director said, Dr. Etienne said, continue to be patient. We cannot think that because we have flattened the curve, this will disappear. We are already seeing in Europe new waves, new peaks, as well as we see in Australia and in other countries. So if the countries are able to flatten the curve, the measures, the package of measures have to be maintained with their educational packages so that we can have the lowest impact virus we can get. So we need to take this into account. We do not have answers for many of the questions. As to the vaccine, yes, indeed. The curve in Brazil has shown a decrease. The last time that Brazil reported the highest number of cases on July 29th, that was 70,000 cases and 1,500 deaths. And even though the curve is coming down, it is not completely flattened, and Brazil is not out of this dangerous situation. Yesterday, we saw that the 42,000 cases were reported and 45,000 the day before. So we have also seen peaks. It is important to qualify. Brazil is a very vast country, extensive country, and even though they have increased tests and also measures, they need to continue. Brazil has some areas that have not been exposed within the population. So we cannot say that Brazil is beyond the problem. We are hopeful, but we shouldn't think that this is over, because we should also remember that the models used by these prestigious institutions are just models and forecasts based on numbers, but they are not actual data. They have shown a decrease in the curve, but we should also remember that in many of these countries, this is a very significant reporting of cases, but it is not the complete number of cases. So the idea is to continue with the same package of measures and expect that that curve can be completely flattened in Brazil for the benefit of their population. Thank you. Thank you, Dr. Espinal. Now I would like to give the floor to Melina Ochoa, journalist with Uno TV in Mexico City. Melina, you have the floor.
Bueno.
Can you hear me now?
Perfecto.
Yes.
Muy buenos días a todos.
Very well.
Mi
Good morning to all of you.
es
My
la
question
Organización
is the
Panamericana de la
following.
Salud
The
afirmó
Pan
que
American
México
Health
llegaría a su
Organization
pico
asserted
de
that
casos
Mexico would reach their peak
máximos de
of cases
COVID-19 en
for
agosto.
COVID-19
Esto
in
ocurrió.
August. Did
Septiembre
this
será de
happen?
descenso en
Will
casos.
September
Muchas
show a
gracias.
decrease in the number of cases? Thank you. Thank you, Melina. Dr. Ugarte, could you please address this question? Certainly. Mexico is a vast country, and the pandemic has various degrees of transmission and number of cases and deaths. But we can say, for example, that this week, one state has a red light in the traffic light system, and 10 are in yellow. So that means that clearly there is an evolution, a positive evolution, and there are some relevant indicators. For example, the trend in the number of cases, also the bed occupancy at hospital level, and the positive rate for tests. I should also remind you that Mexico has modified their case definition for suspected cases from acute respiratory infection so as to also include more cases and also to make better decisions to face the high positive rate that they had in terms of the tests that they conducted. So the general recommendation is for Mexico and all of the countries that are currently showing a trend towards a reduction in the number of cases, precaution measures should be implemented, as well as social distancing, hand hygiene, the use of masks, the identification of early signs and symptoms of some possibility for or likelihood for a person, a family member, or a co-worker to have symptoms that are compatible with COVID, initiate isolation of symptomatic patients, as well as the quarantine of contacts, contact health services, so as to implement the proper tests. those measures need to be implemented, and we are hoping that the trend will continue to be downward in Mexico and that the measures that are adopted will have a positive result. But we also need to be extremely cautious and protect mostly the elderly, and those who are diabetic and who have high pressure problems, who have heart problems, obesity, as well as those that are at high risk for disease. Why? Because when the number of cases go down and the health facilities are not overwhelmed, we have the feeling of an apparent safety, and the virus will come back to with higher transmission, and those that are the most vulnerable will be the ones that are the most affected. So not only in the case of Mexico, but also with all of the other countries, we need to understand that this is individual and collective behavior. Thank you very much, Doctor. The next question through the chat is by Jacob Quincan from Miami Herald, and he says,
leading the world in the most relevant coronavirus metrics indicating the impact of the virus. Why has the country been hit so badly? Is altitude a factor in coronavirus outcomes? Doctor Espinal. Doctor Espinal, su micrófono. Gracias.
Sorry. As I said earlier, thank you very much. As I said earlier, I think the director has mentioned also in previous remarks, we don't have the answer to all the questions this virus is generating. And certainly we need to be patient. Peru is a country with a high informal economy, where it's more difficult to exercise social distance and other important measures. It is also a country which has different geographical areas, some of them very difficult to access. There are areas in Peru that only one can access through air. It has mountains, the Andean region, it has sea, and it has forests, the Amazon. So it's not an easy situation on that. Also, Peru is home, as Latin America also, of several groups of population groups living in situation of vulnerability: indigenous people, Afro-descendants, women and children, people, prisoners, and so on. So it's a series of factors that influence the behavior of this virus in Peru. But I just wanted to point out that every country is different, and comparisons are difficult. So my take is that we need to be patient. We need to continue implementing the measures. Let me also say that Peru has recently decided to revise the numbers and added, for example, mortality data that is contributing to improve the numbers in Peru in terms of being transparent and more proactive in revising these numbers. So while Peru has been heavily affected, I think the key issue is to continue the package and not despair, because we hopefully we're going to see the curve flatten, and hopefully in the near future. Thank you.
Muchas gracias, doctor.
Thank you very much, doctor. The next question is by Vanessa Davis from Contrapunto, Venezuela. She's saying, Venezuela is reporting 1,000 cases a day. So is Venezuela in a situation that would allow them to go back to schools? And what do you recommend for protecting students and teachers? Dr. Ugarte, thank you very much. Whenever there is community transmission of the virus, that transmission clearly covers everyone. And whenever there are gatherings of people of different ages at university level, elementary school level, and also children that are sent to daycare centers, that increases the probability of transmission. So evidence has shown that social distancing, physical distancing, and the isolation of infected individuals, as well as the quarantine for contacts, have had very significant results in the reduction of transmission. And those general principles should be adopted in the case of any country that is starting to reopen the schools, and such as Venezuela, where the number of cases is clearly increasing and the reports are also showing active transmission. It is necessary to have extreme measures, and if the schools will have to be opened, so specific measures need to be implemented for the airing of the rooms, distancing among the students, the use of facial coverings. Yes, masks or cloth masks that could be used by children, as well as areas to sanitize their hands, and areas to have in-person classes and give priority to those classes that do need to take place in person, but have homework done at home and other tasks that could be done to be actually done at home. And we need to give priority to teachers and those that have a higher risk. It has already been shown that whenever schools open, there is an increase in the number of cases. They need to be prepared to implement immediate measures for the reduction of the transmission in those centers, and also allow for access to diagnostic tests and also treatment for those who need it. We need to remember that this goes beyond the youth and children. We also have here the grandparents and the elderly, people who have some sort of disease who are back at home and that could also be affected by this population. We also understand that the mental health of children and adolescents, and in general of the population, as our director has mentioned, is very important, something that needs to be taken into account, and we need to have a healthy reopening with the implementation of all the measures to avoid transmission. Thank you. Thank you very much, Doctor. We have two questions that are linked to treatment. One by Carmen Pon from Politico that reads,
any overview of what therapies are in the late stages of testing and may seek regulatory approval in different parts of the world by the end of the year at the latest. Y también de Susana de O Globo en Brasil dice, could you please comment on recent research showing dexamethasone, a corticoid, as efficient medication to reduce patients' time in intensive care? Will the drug be included in the treatment protocol recommended by WHO and PAHO? Doctor Espinal, ¿podría tomar estas preguntas?
Yes, thank you very much for the two important questions. Yes, WHO has been involved heavily in research and development since the beginning of the pandemic. And there is the platform, the International Clinical Trial Registry platform, which is public domain and is available. It's a WHO initiative. It has more than 5,000 entries. There are several thousands of hundreds and thousands of clinical trials going on. So WHO is monitoring those. The key issue is when the evidence comes out, to evaluate and assess the evidence by peers and independent expert panels and so on, to make sure that can be recommended. It cannot be only in the recommendations only on personal basis cannot be done. It is important also the replication of those trials sometimes. So while some medicines can be used on emergency basis, the final recommendation needs to come out of these clinical trials. As early as February, WHO organized a forum to address the first questions of research questions about COVID-19. And then in March, it published the roadmap of research and development that includes a full section on new therapeutics for COVID. and just also publish the individual profiles for therapeutics and other products. So very well involved and monitoring those. In PAHO, we are also conducting assessment of each of the evidence available on a new medicine that is claimed to be functioning or not, and is available. We have living documents in our website that you can perfectly access to those. Regarding dexamethasone, shortly, yes, it has been shown in clinical trials that it does help in shortening the stay in intensive care and can be used, and is being used and recommended by several of our countries. And it's one of the medicines that can be used in the armamentarium against COVID. Thank you.
Gracias, doctor. Tenemos algunas preguntas sobre Nicaragua de Julio Estrada.
We have some questions from Julio Estrada, La Prensa, and through the chat, Julio Velázquez from Despacho 515 from Nicaragua. They're also asking about transparency. And Julio Estrada is saying, to date, the Ministry of Health of Nicaragua, in connection with the Ministry of Health, have they been transparent regarding the number of deaths for COVID-19? And they're also asking whether with the increase of cases of malaria, among other diseases during the rainy seasons, what could be the situation with the increase in cases and the pandemic? Dr. Ugarte, thank you very much for the question. As you know, the authorities in Nicaragua provide weekly information that is quite brief in connection with the number of cases and deaths, and that is the same information that is reported through the international system. So the number of cases and the number of deaths are reported through the official channels, but there are some unofficial channels that show different figures to the ones that are provided by the authorities. As to dengue, leptospirosis, and malaria, these diseases do increase during the rainy season, and our priority has been to strengthen other health services beyond COVID so that we can address these diseases and other diseases that have an impact on the countries. As a matter of fact, there is a problem with the way the surveillance systems are overwhelmed, as well as the labs, and the reduction in the number of health workers that are available for other services that are not COVID related, and also the fear that the population has to go to healthcare centers because they have the impression that they will be acquiring the disease, so they are not reporting their diseases. And there could be confusion also between one disease and another disease and COVID. This should be highlighted, and only regarding the strengthening of the surveillance and also the maintenance of the other health services and essential care services. That would be the only way to cover all of the aspects that are the responsibility of the health care authorities, and as well as the population. The population will have the responsibility, for example, to reduce vectors and also to implement all of the measures, because life goes on beyond COVID. We need to maintain services. We need to establish measures to adapt as part of the vector diseases, and also measures for clean water and cleanliness. And also these are the individual responsibilities and part of the community responsibilities, with the support, the guidance, and the supplies and healthcare personnel deployment. If you allow me, Sebastian, to add something, Nicaragua has a very severe problem in Puerto Cabezas with malaria. This is an old problem that worsens with this pandemic, but it is important for Nicaragua to note that we can eliminate malaria in Puerto Cabezas and in Central America. So this is not only related to COVID and the situation that we currently have. Thank you. Thank you very much, both. Paula Lindo from Trinidad and Tobago Newsday would like to have more information on the percentage of tests that is considered a good range. She's saying,
Tobago is currently at 5%. Is it that we should be testing at a certain rate per population size, or should we still be aiming for a certain percentage of tests to be positive? Dr. Espinal?
Thank you very much, Paula. Yes, the 5% is good because the recommended level is less than 10% and 5% much better. However, let's not be confused because still Trinidad and Tobago needs to step up the testing. I mean, depends on the number of testing we do epidemiologically. And as we were yesterday discussing on a television interview in Trinidad and Tobago, it is important to increase the testing. And PAHO already, it's working with the national authorities through our country office to make sure Trinidad and Tobago receive antigen testing that has been ordered and should be there anytime soon. So it is important not to think only on the seropositivity rate as 5%, because we need to have a clear magnitude of the problem if we increase the testing. So both are the same way to increasing the testing and keeping that rate low. Thank you.
Gracias, doctor. Y ya estamos llegando al final de esta sesión.
Thank you, doctor. We are reaching out the end of our session. We have received some questions related to international travel and borders. This is a question from Factor RH in Mexico. And to sum up, they're asking,
reopening their economies, including resuming non-essential international traffic. What are PAHO's recommendations to these countries? Dr. Etienne?
So let me thank you for this important and what I consider a timely question. In recent weeks, PAHO has been in close consultation with many of our national authorities throughout the region about just that, how to safely and responsibly resume non-essential international travel. So resuming travel increases the risk of international spread of COVID-19. Let's be clear. So it is vital that countries take a cautious approach that includes a series of mechanisms to mitigate the risk of importing and exporting the virus. It is important to remember that COVID situation is unique in each country, as many of Ciro and both Marcos have mentioned, and it must be evaluated in that context before governments make the decision about resuming travel. For example, what are the transmission dynamics of the virus in the country? What is the testing and contact tracing capacity of the country? Is the health system prepared for an influx of cases in the event of a new outbreak occurs? So for countries that make the decision to resume travel, PAHO has made the following recommendations: that you continuously monitor the capacity of your health system to ensure that you are equipped to handle any surge in cases. You must be selective in authorizing incoming international connections based on the epidemiological situation in the country of origin. You must establish systems to encourage social distancing at airports, to ensure that the passenger flow at airports is as swift and fluid as possible. And you must establish strong systems for contact tracing so that the health of international travelers can be monitored during the first 14 days in your country. So this will help countries react more quickly to any importation of the virus. So finally, I want to also stress that managing the risk of resuming travel is also a shared responsibility between countries in our region, between levels of government within countries, but also among the individual travelers who must adhere to the hygiene, distancing, and personal protective measures. Too often we have seen that international travelers do not adhere to the well-defined measures that have been given to them and have been explained to them, and thus spark off clusters of cases within countries. Thank you.
Muchas gracias.
Thank you very much, Dr. Etienne. Now we have just come to the end of this session. We would like to thank you all for your participation. We will be soon sending the opening remarks by the director as well as the recording of the session. We'd like to let you know that next week we will not be hosting this briefing, but you can continue to contact us via email, and we will be addressing your questions as soon as possible. Have a nice week, and thank you for your participation. Greetings to all.